All right, hello everybody. As promised, we are live from the attic and looking forward to a discussion that is, I think, very much needed as we continue to see both information and misinformation flowing widely when it comes to COVID-19. We're just going to allow a couple minutes for folks to join us, and then I'll be inviting Dr. Dara Kass, who's a good friend and somebody who has a lot of insights and is right on the front line. Just as we're getting ready for that, I want to thank everybody who has taken an interest in the work that we've been doing. Thanks for being a supporter during the campaign effort. You know, a lot of the themes that we talked about during that campaign are more important than ever. Now that the campaign has ended, that need for belonging, the need for long-term thinking, thinking not just about what's going to happen in November, but why what happens in November is going to matter to what the 2020s are like, and that we're going to be looking back on this moment from the 2050s. You know, we were talking about that all the time during the campaign. Now it's come to life in a whole new way. And while this is such a complex and terrible situation, this is also one that I think stands the chance of bringing the best out of us. I hope that you are keeping safe. I hope that your loved ones are doing well. And even though this is a tough time for the country, I hope you're also finding the benefits and blessings that can come with this this shock and this change that we're living with. Obviously, I've taken advantage of the simple fact of not having to shave every day. We'll see if that lasts. But one reminder that that there's freedom in the breakup of routine, even as we have a lot of concern too. I'm valuing the chance to be at home, the chance to spend time with Chasten, who sends his greetings, and even as we gear up for what's going to be a very difficult time, I hope we're also able to concentrate on what matters most in life. I think we're just about up and running, so I'm going to now, if I can do this properly, invite Dara to join us. And again, for those of you who haven't had a chance to see her recent media appearances, she's been a great source of information. There we are. Hello, Dara. Thanks for joining us.
I'm proud of you for doing that successfully.
Yeah, you know, I got to say, I'm accustomed to having a lot of staff members and team members watching my every move, making sure we get things right. Just me with maybe Buddy and Truman lending a hand later. So I'm glad we've gone this far without me pushing the wrong button. So again, to everybody who's watching, Dr. Kass was first of all, a great friend and a supporter during the campaign, but she is also somebody who is on the front lines of this, working as an emergency room physician in New York City, which is one of the hardest hit places in the world. One of the reasons I think it's really important to hear from her is that there's a lot of information, but also a lot of misinformation going out there. And since we can't always rely on national leaders right now to be sharing good information, I want you to hear directly from a medical professional. Another reason I think it's very important to hear the view from New York is that what is happening there is an example of what we may expect to see in other parts of the country too. So even if you don't live anywhere near New York, understanding what is going on there could shape the way we can respond in different parts of the country. So Dara, I know that you have been incredibly busy, both as a medical professional, even conducting telemedicine while you've been indoors, and as somebody who has been making appearances from CNN to network television, helping to educate Americans. I'm so glad you're with us right now. Before we get to any of the many questions that have come in, I want to first ask how you're doing, because you yourself tested positive for COVID-19. I was hoping you could share a little bit about, first of all, how did you know that you might be coming down with something? What did the test tell you? And most importantly, how are you doing?
So first and foremost, I feel very lucky. I think that we know that this disease, when it hits you, you don't know what's going to happen. That's true if you're a regular person, if you're a doctor, and sometimes a little bit worse the more you know. For me, I was actually seeing patients on telemedicine the first week this came to New York, and then I saw patients in the ER for a couple of days. And the first day after that 7-day period where we're starting to see an onslaught in New York, I woke up and I was just like sore. And I had this weird loss of taste. And I was like totally tired, and they didn't understand. I'm like, maybe I'm nervous, I'm anxious. This is like a hard time for all of us. And I'm internalizing all this anxiety of like my friends and my family trying to take care of patients. And then I started developing a cough and a headache. And I was like, maybe this is more than just the anxiety of taking care of people in this moment. And so 2 days in, I decided to register as a patient myself. on telemedicine, and I spoke to a doctor the same way. You know, we want to make sure that we seek care when we need it. And I gave my symptoms and I gave my exposure, and the doctor said, you know, you're at risk. And we, at that point, I met criteria to test in that environment. And I went and got swabbed just like everybody else. And I had results actually pretty quickly after that. So I knew from onset was on a Monday. I knew by Thursday night I was positive. And at that point, I'd been mostly at home seeing patients on telemedicine. I hadn't really gone out very much. So I quarantined myself in my house. One of the really hard things to do is to quarantine yourself in your home from your loved ones. And so my husband and I, who had decided that there were rooms I was allowed in and rooms that he was allowed in, we really kind of drove that home once we knew I was positive. And I actually wore a mask in my own house between the rooms that I was allowed to be free in. And that's a very odd feeling when you're walking on the hallway between your bedroom and the bathroom, and you have to wear a mask in your own house. But because this virus lives on surfaces and it's aerosolized, meaning that droplets from when you speak can actually get to the countertops in the kitchen, you want to make sure to wipe down the surfaces of all of your bathrooms and kitchens if you're trying to quarantine at home, because that's why we see spread between families. So I don't know. I think we were successful in my own house, keeping it from me to my husband, which means maybe he's better at protection of himself than I am in the ER. But, you know, now I'm 10 days out. I feel really good. I feel very fortunate. And I'm just now trying to take care again of patients who also are figuring out where they fit in the spectrum.
Well, thanks. It's I think it's inspiring to see, even as you've been battling this virus personally, you're also continuing to help others do it. And I think that's a real testament to your motivation as a healthcare professional. So thanks on all fronts, and wishing you 100% recovery soon. That raises one of the questions that I think is also on my mind, and it comes in from Grassy, and it's this: if you might have COVID-19, should you actively seek a test, or should you only self-isolate? Let me add to that question, you know, does that depend on your situation? So if, let's say, for example, you're a 38-year-old, generally healthy person, but you've heard everything from the stories about how this can hit people who are younger sometimes too hard, and you're just worried about spreading it, you think you kind of sort of might have it. How do you know what to do?
So I think that, okay, first of all, the ability to get tested is actually going to affect on, it's going to be correlated to where you live, right? Mm-hmm. So in New York City right now, we're doing more tests than anyone else in the country. Yeah, we're only testing people that need to be hospitalized or are healthcare workers with significant symptoms like fever and cough. So right now, I never had a fever. I wouldn't meet your criteria to be tested in New York right now. And that has to do with the demand versus the availability of testing. Right? This is one of the things that we were missing in the early ramp up to this, was that the testing wasn't scaled federally. And so each state had to figure out how to solve it for themselves. So if you live in a state or a city that has available testing, as states and cities are doing, and you start to have symptoms, you may be able to get tested in your area with a different kind of cohort of symptoms than I would be able to get tested in New York. The way that we're describing it, and the loss of taste is a super interesting one, because it's really specific to this particular virus, it seems, in this moment. There was an article out that said that if you lose taste, you should presume you have COVID. And I actually think that's a fair thing to do right now, right? So the symptoms to think about: headache, and I'm talking about like an unrelenting headache when you don't normally get it. You know, muscle aches. So I was so sore in my back and my legs, I started using a foam roller and I couldn't stretch. You know, the taste, this metallic taste, you basically don't want to eat anything. And so you just you stop eating when you're full, which is a new thing for some of us, you know? And then things like the cough. So it's a dry cough. It's like you speak and then it's like a cough. Those are the symptoms that manage at home okay. The other symptoms are the ones that we start to worry about more. Oh, I want to say, so some people are having GI symptoms, right? Which is a diarrhea and some nausea. Again, one that can be managed at home. The ones we start to worry about, the shortness of breath, right? Fevers. So the dangerous part of COVID, the part that we're managing in the hospitals, right? That's the pneumonias. What happens is, on the course of disease, some people are getting of viral pneumonia, and it's kind of spread out. And the first calling card of that is usually a fever. Now, that does not mean that everybody that has a fever is going to have the pneumonia at all. Okay. But you have these fevers, they're 102, 103, and then you start getting short of breath. And the course of time seems to be somewhere between 1 day and 10 days. So if you've had it and day 4 or day 5, you start getting a fever and a cough, we want you to pay attention to how short of breath you are. Okay? Because what we need to do is keep the hospitals open to evaluate the patients that are having this shortness of breath, because they might need oxygen or they might need one of those ventilators, right? A lot of the conversation right now is on the availability of resources for patients who need it. We know from today's press conference in New York that of all the patients that are being positive for COVID right now in New York City, 13% are requiring hospitalization and 3% are going to the ICU. Okay? Those 13%, a lot of them look like me and you, which is a new feeling for us, right? We're not used to seeing people our age, right? I just got used to telling everyone you were old enough to be president, right? Now I'm telling everyone that you also need to worry about really your own mortality, right? And so there's a real sense of panic amongst the 30 and 40-year-olds, and in some ways disbelief that this can affect them, because we're not used to this idea that we can get really sick really quick. You know?
What I'm hearing is it's just not true that this is only dangerous if you're over 60 or if you're immunocompromised. This could, at least for some people, be dangerous or even deadly for somebody who seems otherwise healthy and is closer to our age.
Yeah, absolutely. And it's unpredictable, right? You don't know, how smart you are, no matter how much you really pay attention to what's going on. You don't know how it's going to affect you. And that's why when I got it, I was just as scared as everybody else, counting the days to make sure that I was okay.
So now let's say that you're not experiencing the kind of combination of fever or shortness of breath that suggests you should probably might need to go to the hospital, but either you've tested positive, you have it, or you feel like you probably have it. What is available over the counter, either from your own experience that might have helped for you? I know there's a lot of maybe unsound or untested suggestions coming out there about what works. But let me ask 2 questions. First of all, is there any treatment known that affects the virus itself? And then secondly, whether or not there's anything out there that can help to kill the virus when you're infected. What are some things that are likely to be helpful if you do have the symptoms that are available over the counter?
So the 87% of people that are not going to need to be hospitalized, which is the majority of the people we know, and the majority of people in our life, are going to do the same thing they would do for any virus, right? They're going to take Tylenol or Motrin. There was this question about whether or not you can take Motrin, and the reality is that that's not proven. If you want to try Tylenol first and it works for you, stick with Tylenol. There's no downside. You want to stay hydrated. You want to make sure that you rest. You want to stay away from your family and, for the period of time and stay quarantined. That's the majority of people. This is still a new virus, right? And so we don't know a lot about how it's affecting people, and more importantly, how to treat it. There are certain treatments, medications we've had for a long time, out of, medications for malaria, combinations with antibiotics, vitamin C, all these things that are coming out in the media that can be used to treat patients who are very sick in the ICU. Okay. We are leaving it up to the hospital doctors and the ICU doctors to pilot those medications. What we don't want, and what we've seen already happen, is people try to take care of themselves at home with unproven therapies, right? We've had overdoses already of people taking the wrong medication, right? These medications are being touted as safe because they're old, but there's a lot of old medications that are not entirely safe, especially in combination, right? So we need to make sure that patients are not treating themselves because they're hearing stuff in the news media that's not proven medical advice. There are promising therapies for this. There will be a vaccine in a year, okay? What we need to do is get through this moment, and that's why things like social distancing and over-the-counter treatments and keeping the hospitals open for sick patients are really, really important.
Yeah. So that brings me to another question I think is on folks' minds, which is, okay, what can we do if we're trying to go about our lives, but we're mindful of this? We've heard that the best thing you can do is keep the pressure off hospitals by staying in, but at a minimum, you need food. Erica asked, what can we do to protect ourselves when going to get groceries? And Joe asked, should I be concerned about bringing mail and groceries into the house? We've heard about, different surfaces maybe being able to host the virus for different amounts of time. What's a way to think about this that is reasonable, that makes it possible to at least go through the basic functions of life, and at the same time is responsible and as conservative as we should be, knowing that, most of us don't have hazmat suits and protective equipment, but all of us need to get food. And let me put one more asterisk on that just before the question, which is also, for those of us who are looking after others. If I'm, I put some effort into convincing my mother to not go to Costco this morning, partly by promising that I would go ahead and get things for her. A lot of people out there are, participating in volunteer efforts to try to get food for others. So whether you're talking about getting groceries for yourself, or whether you're talking about wanting to be able to deliver and make something available to somebody who definitely shouldn't be leaving the house. What are some things that we should think about and should know?
Okay. First of all, I don't cook, so this is a solution. This is something I've thought about a lot. Okay. And there's no reason to avoid taking out food. In fact, it's one of the ways to keep our economy going, right? Restaurants are taking seriously their own hygiene. There's no evidence that this virus is transmitted through food specifically. What I will say is if you're going to go outside, first and foremost, wash your own hands, right? Make sure that you're responsible, because you also don't know if you're an asymptomatic carrier, right? So you go out, you wash your hands, you don't touch your face, right? You go, you do what you need to do, and you come home, okay? There are a lot of ways now when you order in food to do no contact drop-off. So there's a lot of, you can actually click a box. It protects the delivery worker and it protects you, so that they just drop it at your door. I would say be generous to delivery workers right now. They're having a hard time, and that they're, part of keeping this economy going is figuring out how to live in this new moment, right? And so we have to do things like figure out how to keep delivery workers working and kitchens and restaurants working. I ordered in dinner last night, and my husband called me and said, they were really thankful for our business. They literally said, thank you for ordering, right? I was happy to get the food and they were happy to get the business. So I think that's okay. And I think we should consider do that. With your mom, and maybe this is an Instagram live for those not generally on Instagram. We have found in my own personal network that our parents are not very good at listening to this. Is that your experience, Mr. Buttigieg?
It's a bit of a struggle. If anybody knows my mom, she's not designed to be indoors all the time. So she's trying to behave, but definitely, I think our generation is learning a lot about persuasion with an older generation that just is really having a hard time with this.
So if you're over 65 listening to this Instagram right now, this is for you, which is please stay home and let us help you, please. It comes down to this. Yes, people who are older are more vulnerable. It's not a guarantee, but we don't want them to get it. My friend Craig says if the virus doesn't touch you, the virus can infect you. That's the way I want them to think about this. They don't need to go to Costco. I know they really like Costco. There are so many aisles of lots of stuff, right? But no, it will be there when this is over. I promise, So I think that what we can do is we can offer to help our parents and families. We can offer to do the same thing. Protect ourselves as protecting them. Okay. But yes, you should be the one going to Costco, or Chaston. He's younger than you anyway.
There you go. So speaking of which, he just went out to make a run, and we were talking as he was getting ready to go, groceries versus takeout. It sounds like what you're saying is there's no obvious direction to do one versus the other, but there are ways to minimize your risks, whether you're going to pick up food at the store, whether you're going to go pick something up from a restaurant or order in.
And what I would say is this: a lot of my friends who are worried they have it are also the ones cooking for their families. And so they started wondering, should I be the one cooking if I'm the one infected? And I would say no. I would say if you're seeing that you have symptoms and it's possible, let somebody else cook for once. Order in a little bit more. Pizza's okay. My kids who are watching TV a lot right now would probably like to get more pizza. Because it is important that if you're the one infected, you don't realize, but you may wash your hands, even wear a mask when you cook, and then you wipe your nose and hold the plate. And that would be a really unfortunate way to infect somebody else. So yes, these are hard choices to make in your own family. It's the reason why other countries actually move out patients who are just being observed, to separate housing. And I hope eventually we get there. We're not there yet. But ideally, we would have people quarantine themselves away from their families. We're just not there yet.
Got it. Let me ask one other question. I want to zoom out during the time we have to some bigger picture questions. But one more thing in the realm of health, which is a great question from, I can't even make out the handle here, but I love the question. How has mental health been a factor in this pandemic? What do we need to think about in the interaction between mental health, especially as this lockdown goes from days to perhaps weeks or more?
So I woke up 3 a.m. last night and couldn't sleep. And I realized that all my COVID symptoms are being replaced by general anxiety symptoms. I mean, it is a really scary time for all of us in healthcare, just regular old Americans. And the answer is whatever you can do to unload this anxiety, right? We have to figure out each of our own way to handle the stress. It may mean downloading an app that is a meditation app. It may mean deciding that you're allowed to have ice cream every night if the day isn't so bad. It might mean talking to your friends and doing Zoom calls with your, no endorsement intended, of course, but doing video calls with your friends from high school all of a sudden again. Whatever you can do to anchor yourself in this moment and connect with your family and friends to get through what is a really uncertain and scary time, but do something. Don't ignore this, because we're all internalizing a lot of anxiety, and that's going to manifest into symptoms, whether it's nausea or headaches or, muscle aches and fatigue. That's going to make you think you have it, even if you don't. And that's what I thought was happening to me the first day. And so it's real, and you've got to acknowledge it to be able to get through this.
So I want to go now to where this meets the economic picture. Somebody just commented, I'm worried about being told to go back to work after Easter. We also heard the president say that by Easter, the virus will be under control. Is there any way that that's true? And of course, nobody has all the answers on timing, but what do you make of this suggestion that we should think of Easter as a day when something changes?
So I originally was saying a couple of days ago that we're like mile 1 into a 26-mile marathon. So nobody's really looking at the finish line anytime soon. No scientist, no doctor is ever going to say that arbitrary limits and arbitrary timelines are a good idea right now. If we see, it's like a pressure cooker, right? There's an elevating pressure, especially in New York right now, but now we're seeing in other cities, in Louisiana, in Colorado, where the cases are escalating and escalating. We are not going to be able to decrease the social distancing in those cities anytime soon. It may be true that there are communities that don't have a high incidence of disease, who are testing appropriately, who can open their doors, who can go back to work before Easter to some sort of a new normal. And that would be wonderful, right? But what we know is we need to let the scientists manage that. And we need to do that based on data and based on the actual disease escalation, and not just because there's a holiday that makes somebody feel better about churches being full.
Right. And, this goes to another question. We've seen there's so many different voices, even on the government side, who are out there. We've got mayors and governors stepping up. We've got the professionals at the federal level, and then we've got the president, who often is saying things that are different. Michael asked, how much harder will this be to contain if the Trump administration continues to take a back seat? And alongside that, in terms of the good, the bad, and the indifferent, what are you seeing in terms of states that are taking steps that just to your medical way of thinking, this is really going to make my job easier? And what are you seeing happen that's making your job harder? And how can people tell the difference in who to listen to when we see different kinds of political and public figures speaking up who maybe are not medical professionals?
So I live in New York, and I'm super proud to be a New Yorker for lots of reasons, have been since the day I've been born. And we know that Governor Cuomo has taken a real leadership role nationally right now as basically the governor's governor. Somebody told me once that local leaders, mayors, and governors, if the country looked like our best friend states, we would be, we would do pretty well. And, that's what's happening right now.
Thanks for remembering our stump speech.
I listen to it a lot, and it comes down to this. It comes down to the governors of certain states, specifically New York and California, but also other states, Colorado, Ohio, are doing a great job, right? Messaging to their citizens that this is a problem we all must bear together. It doesn't matter if I'm a Republican governor, I'm a Democratic governor, but I'm a governor of the people. The briefing I watch every day from Cuomo informs me of what's happening in my state as a citizen, not just as a healthcare provider. In Tennessee yesterday, there was a petition started by doctors in Tennessee because their governor was not acting in accordance with the best practices for this. And they, as providers and as citizens, started getting nervous, and they started saying, stay home, keep us home, keep us home. And that's if you're a citizen in a state that has a governor that's not conforming to these best practices, you still can stay home, right? It is okay to just protect yourself and your family, because if the virus doesn't touch you, the virus can't, if you don't touch the virus, you can't get infected, is true even if you live in a state with a governor that's trying to tell you to go back to work, or that you're somehow 70-year-olds are expendable for the economy because they think it's their American duty to contract this virus, knowing there may not be ventilators for them. That's just not the way that we're going to do this. The thing that's amazing about New York is we're seeing our doubling time. So the time between patients, the doubling of hospitalized patients is actually getting longer and longer. And what that means is we're doing a good job with our suppression, keeping the hospitals open. That's the goal here, to take care of everybody, because it might be you that needs one of those ventilators or hospital beds, not just your 70-year-old mother, who I hope you like.
So just to be clear, nobody's doing anyone a favor if they say, I'm going to take one for the team and go out there and live my life normally. And if I get ill and don't make it, too bad, right? Because there's a hospital bed that you could be tying up, or thousands of people you could eventually lead to the infection of, right?
So A, you can go out there and decide that you're a martyr, but you're going to get somebody else sick. B, if you get sick, Lieutenant Governor of Texas, even though you don't think that it's that important, I think it's pretty important to save your life, and I'm going to give you a bed and a ventilator, regardless of how you felt about going outside. And third is, think about everybody else if you don't want to think about yourself, right? This economy is not going to go raring again anytime soon, regardless of whether or not you want to go out and go shopping at Costco. It's just not.
Right. And that's one thing to be clear of. I mean, medically, we need the economy to take a break, even as we're, from a policy and political perspective, needing to make sure that people are not economically punished for that. I think that's what a lot of folks are missing in the economic debate. This is not a normal stimulus package, because the reason people aren't going out and shopping isn't that there's no demand. It's that we have to stay in order to save lives. And so it's one of the reasons why getting direct aid to individuals, cash support, is so important alongside the other forms of economic aid that are being debated right now. And I just want to echo what you said about Governor Cuomo. It's been remarkable to see the way that he stepped up and offered the kind of, I think, clear leadership and honesty about what's known and what's not known that we're going to need in order to get through this. I know we're hitting up against our time, and you've been very generous with it. I want to ask, I thought a great question that came through. In fact, I'll ask you, there are a pair of questions that you could kind of take together. Dua Chicago says, these are challenging times. What motivates both of you? And then Andrew says, what is one reason to remain hopeful during this horrible time? So
I'll do the hopeful part, and then you'll tell me what motivates you, and I'll tell you what motivates me. This is the most American moment I have seen in a long time. Okay. I look at my Facebook feed of my friends I've met from high school, college, nursery school, their parents, whoever they voted for, wherever they live. Everybody is rallying together to fight this virus, whatever they can do, whether it's making homemade masks or offering to find somehow, PPE for people in their environment, offering to drop off, food or snacks. I have 3 texts about sandwiches asking which hospitals I would tell people to donate food. Everybody's trying to do something, and that's remarkable. It's an opportunity to really kind of chip in and help your fellow Americans so that they can go out into the front lines and save lives. My husband just said, it's, all these people that have been underappreciated in the background so long. Our, hospital janitorial staff is so critical right now in keeping us safe. Thank them. If you know somebody that's a sanitation worker who's going out there and picking up literally your garbage to make sure that our streets are clean right now, thank them. It's a real opportunity to recognize the work that's usually unrecognized. And that gives me kind of hope, because I think it's an opportunity to reframe that in this American story. So what motivates you?
Well, first of all, I love the way you put that this is a really American moment. And it's true. So many people are playing a role and stepping up. I think it's taking more creativity than before. If this were a normal, if this were a flood, everybody would rush down to the river and fill sandbags if you could. We can't gather physically in the same way we would in other situations. And yet people are finding so many ways to be helpful. That's what's motivating me too. That and the knowledge that even the most terrible things that have happened to countries, to people all also can bring out the best in us. I always said on the campaign trail that why leadership matters is it can bring out the best or the worst in us. The same is true of adversity. And I believe this is a moment when we could look back and, as terrible as it is, also be proud of the way we individually and collectively stood up, looked after one another, did what we could, whether that meant going out and volunteering in some way or whether it was as simple and as difficult as having the discipline to just stay put. Which is sometimes the hardest and most important thing to do. I know our time is up. Thank you so much for the work that you're doing. Thank you so much for taking time to speak with everybody here, and for everyone who's watching. I hope you take this advice to heart. I hope you keep seeking sources of good information and spread that around. And I hope we'll have a chance to connect again before long. Dr. Kass, thanks so much for joining us, and
Thank you
stay
so
safe and stay well.
Thank you so much for everything.
Thank you. And to everybody who joined, again, I appreciate being able to spend a little time with you. I think it's so important for us to find new ways to connect, to engage. I'll tell you, it's a strange feeling to go from seeing thousands of people in one day to being right here at home all day, and yet being able to engage with thousands of you right now reminds me what's at stake. And we've got a community of supporters that can do so much good, even if we have to do it in ways that we're not used to. So thanks for being part of this conversation. There will be more to come. And again, listen to good advice. Stay home, be safe, protect yourself, protect others, and I look forward to seeing you again. Take care, everybody.